And thank you so much for joining. This is the Ohio AAP's Safe Sleep Champion Network webinar. We are very excited to have everyone in the audience today and to bring this education to you. I'm Haley Southworth with the Ohio AAP. I'm going to start with a few quick announcements. First of all, because of the size of our audience, which we're very excited to have everyone, we will be muting lines other than our speakers. And if you have questions, we will encourage you to use the chat box during the presentation. We will take breaks to read those off, and if time is allowing, we will have some discussion, but please do use the chat to send things in as we're going through all of the content today. Any questions that we don't have a chance to answer live, we will share with our team and send you answers after the meeting. We will be recording the presentation and sharing slides as well as other links and resources in a follow-up email that will come out most likely this afternoon or tomorrow. A couple of other general announcements. To obtain CME credit, you will receive an evaluation link via email. And that online survey in the link will allow you to complete your CME evaluation. This presentation is approved for 1 hour of CME based upon your full participation. The link to the recording and other materials will be included in that follow-up email. If you are seeking additional types of credit, our CME credit is reciprocal to many different options, such as nursing credit. However, there is no social work credit for this presentation. And as I mentioned, the Ohio AAP has approved this for 1 hour of AMA PRA Category 1 credit. A quick disclosure that the planners, faculty, and others in control of content have no relevant financial relationships with eligible companies. And as we are getting started, we're going to do a quick Zoom poll while we continue to admit others. So for today, our introduction poll is going to hopefully help us gather a little information regarding what you currently do when discussing safe sleep with families. So we will use a couple of different Zoom or interaction activity poll options during the meeting today. And this will just help us make sure we're answering hopefully the most important questions that everyone has. So we'll give a moment for this poll to be up while everyone can submit some answers. And while that poll is up, I'm going to do a quick introduction for our speaker for today. Today's speaker is Jamie Macklin. Dr. Macklin is an associate clinical professor in internal medicine and pediatrics, currently practicing as a hospitalist at the OSU Wexner Medical Center and at Nationwide Children's Hospital. She received her medical degree from Tulane University in New Orleans, School of Medicine in New Orleans, and completed an internal medicine and pediatrics residency at OSU Medical Center and Nationwide Children's Hospital. She has been a faculty member at Nationwide since 2011 and the section chief for adult hospital medicine intermittently since 2014. Dr. Macklin's non-clinical interests include quality improvement regarding safe sleep and education on breastfeeding and human trafficking. And she serves on a number of local and regional committees focused on reducing infant mortality, including some Ohio AAP projects where we have worked with her many times in the past several years. So with that, I'm going to end our poll and share results, and then I'll turn it over to Dr. Macklin. So for the results, you can see most of our answers. Looks like the ABCs, sleeping position on the back, sleeping in a crib or pack and play, and removing all the items from the sleep environment are common for most of you. A little bit lower answers for room sharing instead of surface sharing, breastfeeding, and some other topics, which you can feel free to pop in the chat. But glad to hear so many of you are already talking about these topics. And now I will turn it over to Dr. Macklin to share on all of these other pieces for today.
All right. Haley, thank you so much. Thank you so much for having me. I'm excited to be walking us through all of this information today. It is a heavy topic. I will start by saying that if you feel like you need to take a break, you're going to be seeing some images that maybe aren't the most pleasant images today. Please feel free to take a break, leave the webinar for a few minutes, come back if you're able to. Your mental health is of utmost importance here. Again, this is kind of a heavy discussion we're going to be having. But I'm excited to be with you here. Today we're going to be talking about infant safe sleep, child fatality review process, and how it interacts with safe sleep, certainly. And a lot of information to be given, and then ways that you as providers in so many different important disciplines, but providers for child or pediatric care can help your patients and families navigate through all this and practice safe sleep, practices at home and elsewhere. So let's get started. Next slide. All right, here are objectives for this session. There are 3. By the end of this presentation, I hope that you will be able to summarize and identify sources for Ohio-specific data related to sleep-related deaths. Hopefully, you'll be able to come away with new harm reduction strategies and safe sleep conversations with your families. And then we'll also be discussing a number of resources. So you'll be able to compare those and pass hopefully some of those resources on to, regarding safe sleep education and other types of educational resources to your families as well. Next slide. All right, here we go. So this is a slide discussing and comparing infant mortality rates across the world. And I'll start by saying OECD, maybe an abbreviation you're not as familiar with. OECD stands for Organization of Economic Cooperation and Development. Basically, it's a fancy organization, and what it means is these are developed countries. These are countries that generally believe in some form of democracy, market economy, have a number of resources to help, help their citizens. And you can see that we're fairly low, fairly close to bottom of the barrel when it comes to infant mortality rates in these countries. Currently, at least per the last time these rates were put out, we were about 33rd, 34th out of 38 countries in infant mortality. And so you can see, based on America's Health Rankings, where we were back in 2021, 5.4 deaths per 1,000 live infant births. This is not, unfortunately, a new thing for us. We've maybe gone up 32, 31, rankings, down a little bit, but we have consistently remained low in this scale for as long as I have been doing this research, and it's been well over a decade. So unfortunately, not new for us, and certainly a lot of room for opportunity. Next slide. Zeroing in a little bit, over to Ohio. Again, lots of room for opportunity as well. You can see here that Ohio trails the country in our infant mortality rate. This is the CDC database, so CDC Wonder. Infant mortality rate for the period of 2017 to 2022 was 7.11. We are basically neck and neck with Indiana, and overall eighth worst in the country as far as infant mortality. Again, not a proud place to be in, and certainly a lot of opportunity here. So what can we do? And we'll be getting into a lot of the information and causes of infant mortality here, but of course you all are here for a safe sleep webinar. And so, discussing things to reduce the risk of prematurity or low birth weight. So prenatal care, interconception care, vitamins, encouraging breastfeeding, encouraging smoking cessation, both prenatally and certainly after the infant is born as well. But then again, safe sleep. And we'll be discussing a lot about safe sleep as well this next 50 minutes. Slide. So safe sleep, a major cause of infant mortality in the United States, and it's actually one of the leading causes of infant deaths, again, per the CDC. And you can see here, these are kind of broad ICD-10 codes. Whenever data is gone back and looked at for infant mortality, these are the codes that pop up and the leading causes. So congenital malformations, deformities, chromosomal abnormalities, disorders related to short gestation and low birth weight, aka prematurity. That is a big one. sudden infant death syndrome, and accidents, unintentional injuries, and then maternal complications of pregnancy. And I will say that infant sleep related deaths kind of fall into one of two categories, and it really depends on local coding patterns, local practice patterns, what these fall into. Sometimes these are coded as sudden infant death, even if there is like a definite cause. And sometimes they are coded as accidents. And again, it varies from county to county. But either way, a major reason for infant mortality in this country. So talking a little bit about child fatality review or CFR boards and how these relate to safe sleep. A little bit of history here. So child fatality review board started about 25 years ago when then Governor Bob Taft signed a bill into law mandating CFR boards in every one of Ohio's counties. Basically, he wanted the state to understand or better understand why children die. What we certainly don't expect or want any child to die ever, let alone as many as we have been. Why is this happening? What are the stories we can get from these deaths, and what lessons can we learn to prevent them in the future? And so child fatality review boards are tasked with reviewing all deaths of children under 18 years of age in Ohio. Per the law, CFR boards must meet at least once a year to review all deaths of child residents in that counties. I will tell you most CFR boards meet much more than that, as often as once a month, sometimes more frequently, but at least once a year is the law. During those meetings, which typically last 2 to 3 hours long at a time, there is a lot of presentation of information, as you can imagine. When I sat on a CFR board a few years ago, a lot of different parties in the room, a coroner or his or her designee, typically representatives from the counties or the townships, police department, fire departments, counties public children's services, sometimes the primary school district, a representative from the school district, and they're there to present all the information of what they know regarding that child and the surrounding circumstances around that death. They go through all of the information and they come up with contributing factors. Why did this happen? Why did this happen at the time of death? What was going on or what was different? And based on what they determine or what they figure out, is the cause of death, what exactly happened, then they can make recommendations based on that data. So if, for example, I know we've been talking infants, but for example, if there was a child who, stumbled into a pond and drowned, then we can talk about, were there fences around that pond? Where was the pond located? Was there signage? What was around that pond to try to prevent this from happening? And they can make recommendations based on that surrounding environment and what was happening at the time, etc. And yes, you will be getting a copy of this presentation. I'm trying to keep up with a little bit of the chat. And so anyway, lots of data-driven recommendations there. Of note, all meetings are confidential, meaning you can't just sit in on a meeting if you want to. They are limited to those folks that are specifically on the boards, and again, everything is kept in confidentiality. Next slide. So after the meetings, each CFR board provides data to the Ohio Department of Health via a case report tool and then a national web-based data system. Once the Ohio Department of Health staff get the data, they coordinate it, analyze it, and then prepare and publish the annual state child fatality report, which I'll be referencing heavily here in the next few slides. That is available for public consumption. Anyone can get on it if you just get on Google and Google Ohio child fatality report. It is easily found and easily downloaded, and it is a wealth of information. I will say the child fatality review board data is not the same as vital statistics. Vital statistics are they're statistics. One child died, two children died. My slides are being scribbled on, interestingly. So they are statistics and numbers. So delays to CFR boards occur due to legal investigations, locations of death, and other issues. So again, very one-dimensional data. However, the role of child fatality review data is to provide a little bit more comprehensive understanding. If vital statistics are numbered, then CFR data are stories and lessons and a little bit more meat to it to understand and hopefully prevent further deaths. Next slide. All right, take a deep breath, and it's time for another poll. Data from 2018 to 2022 indicated that what percent of infant sleep-related deaths were preventable?
Answers are coming in very quickly. So thanks everyone for sending those in. We have over 115 people here today, so a great audience. I'll give you just a moment longer to sneak in some answers. Okay, it looks like responses have slowed down, so I'm going to go ahead and end the poll and share those results, and then Dr. Macklin can let us know how close to right everyone is.
All right, we have a bunch of smart folks on this call. Let's move to the next slide and we will go through. So in Ohio, again, going through the Ohio CFR data, the child fatality review report, the last one came out in 2023, and it analyzed the period between 2018 to 2022. During that time frame, there were 682 infant sleep-related deaths. That equals out to, if you do all the math on your calculator, greater than 2, somewhere between 2 and 3 sleep-related infant deaths a week. And depending on how many students you think should be part of a kindergarten classroom every year, 5 or 6. So that's 5 or 6 kindergarten classrooms every year of children that aren't there anymore because they died of a sleep-related death. So infant sleep-related deaths accounted for 12% of deaths in Ohio. 78% of those infant sleep-related deaths reviewed were preventable per the CFR committees. That is a whole lot, and we'll go through some of those. So going through the data, and again, all of this information can be found on the Child Fatality Review Report that you can review online as well. So please, if you find this interesting, again, sobering but interesting, I would encourage you to get on and take a look at that report. But we do find per the report that there is no disparity between sexes among sleep-related deaths. Meaning that while females, 41% of sleep-related deaths were female, 59% of sleep-related deaths were male, this corresponded right along to all of the CFR deaths. Again, 58% of all CFR deaths were male and 59% of all sleep-related deaths were male. Similar to females. You can read the slide. But so not disparities there. However, we do see a big disparity comparing Black infants to white infants. Black infants are highly overrepresented among infant sleep-related deaths. And so we see here that Black infants represent 54% of sleep-related deaths, but only 36% of all CFR deaths, whereas white infants represent 43% of sleep-related deaths and 61% of CFR deaths. And I think many of you who maybe have been doing this work for a while or have heard, a little bit, we have a lot of ongoing disparities in deaths in general between Black and white infants in our state. Black infants die at a rate of about 2 to 3 times more than white infants. And so a lot of work to do there, and certainly we see that in this report as well. Next slide. Excuse me. When are they dying? So most infants reviewed by the CFR boards died between 1 and 3 months of age. Now, certainly infants younger than that passed away, infants older than that passed away. But there really seems to be a big, the biggest room of opportunity is anywhere from 1 to 4 months. A lot of reasons here. So if you think about infant sleep-related deaths, we certainly know that they are not, there's a lot of room for development at this point. Infants at this point are not able to roll consistently or reliably. Sometimes head control is, certainly once you get to 3 or 4 months, a bit better, but before that, not able to exhibit strong head control, neck control. We also know that from SIDS research, this is a time whenever infants are neurologically vulnerable for whatever reason, and they're still working on genetic data to figure out why this is happening. But a lot of things go together during this time period to make this a really vulnerable period for all infants in terms of sleep-related deaths. And we certainly see that here in Ohio. Next slide. Where are our babies dying? So a lot of our babies are dying in metropolitan areas. Certainly we see some in what the state calls rural Appalachian, rural non-Appalachian, and suburban areas. And I'll move us to the next slide here just so you can kind of see a little bit more about what I'm talking about. So the state breaks each county down into one of 4 designations. Metropolitan areas are brown, and you can see that these are the areas around Cleveland, Columbus, Cincinnati. Allen County is Lima, and then Lucas up in Toledo. Suburban counties in the yellow, and again, these are the counties surrounding our more urban areas. Rural Appalachian is the green, and that's primarily our southern, southeastern, and northeastern counties. And then rural non-Appalachian, which is our northern and primarily northwest counties. And so that we can see a majority of our infant deaths occur in our more heavily populated or metropolitan areas. So next slide. All right, talking a little bit about risk factors. Unsafe sleep environment was the most prevalent risk factor found among deaths reviewed. And by that, some more components, we'll go into those. But overall, unsafe sleep surfaces for both Black and white infants, a lot of these sleep surfaces involved bedding, and that can be pillows, blankets, sheets, comforters, a lot of things that we don't normally recommend in infant cribs. And again, we'll talk more about this. And a lot of these babies were found not on their back in some other position besides supine. A little bit more information here. So kind of going down our sleep-related deaths, over half were found in a sleep environment with stuff that shouldn't be there, for lack of a better term. Blankets, flat sheets, comforters, pillows is a big one. Many of them had secondhand smoke exposure. Some were in swaddling, although that was not as big of a factor. Some were overheated, again, not as big factor. But again, you can see a lot of the things where there was just extra stuff in the sleep environment where they were at the time that ideally should not have been there. Next slide. Most infants found among the infants that passed away from a sleep-related death were found in an adult bed. And so we know that, adult beds are certainly risky, and we're going to be going through some of that data. Also couches, futons, chairs, other places besides cribs or other kind of areas of safe sleep, approved surfaces are also risky. And so we see here that not only did most infants die in an adult bed, 80% of infants died in an area that wasn't necessarily approved for infant sleep, so a crib or play yard or other surface. Kind of going along with that, most infants died of asphyxia. So you can kind of look at external factors here. A lot of undetermined, a lot of others, but a lot of babies passed away from asphyxia with their sleep-related deaths. Next slide. So the CFR breaks down deaths into kind of medical or kind of more internal causes and external causes. And we just talked about the external asphyxia there. Most medical infant sleep-related deaths were from infection. And so kind of going back to our CFR boards, there is always a pediatrician or a family medicine provider or some kind of physician on that board whose responsibility is to get into the medical record of every child that dies to see what were their medical issues. Was there something that predisposed them to this death? Had they been hospitalized recently? And so this information, this medical infant sleep-related death information is from that. They determined that a lot of these sleep-related deaths were from infection, and that played a role into the death, whether a respiratory virus, recovering from sepsis, some other issue, but infection was a big cause. All right, take a deep breath. Again, a heavy topic. And let's have another question. So a little bit different explanation here. So we're going to ask a question. Please type your answer into the chat, but do not hit send until instructed to do so. Haley will tell you when to do so. So we'll have all the answers at once for a chat waterfall. So here is your question. Don't hit send yet. What unsafe sleep behavior do you see most frequently? Type, but do not send.
Thank you, Dr. Macklin. While we're giving everyone a few seconds to type that answer, I'm looking to see if we have any questions so far. One of the questions we received prior to the webinar was related to where sleep-related deaths are occurring, not the surface so much as perhaps primary residence, daycare, family member homes. Do you have any idea on data related to that while we're giving people a chance?
That is an excellent question. Unfortunately, the CFR report does not actually delineate like where that occurs. I don't know. I know, Haley, that whenever we were preparing for this webinar, I think we'd ask Aubrey Sanchez if she was on. I don't know if she is. But
Hi,
I don't know
everyone.
if she would have any more insight on that data, but it is not in the CFR. I think that is an excellent question, though, because I think it brings to the point, like how do we counsel these families appropriately? And so I think, asking them, yes or no questions. Does your baby sleep in a crib? Does your baby sleep, on their back? It's very easy for parents to say yes, 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 and just kind of check the boxes and move on during a primary care appointment. But maybe far more productive and meaningful if we ask them, tell me about your baby's sleep environment for napping. Tell me your baby's sleep environment for nighttime sleeping. Tell me your baby's sleep environment, or describe to me whenever they're at grandma's house or they're at friend's house or they're at the daycare or like whatever, and kind of going through all those situations, because that question is absolutely right. It alludes to things might be different. Sleeping arrangements might be very different from location to location. So I think that's very insightful.
Thank you, Dr. Macklin. It looks like Aubrey is here. I don't know if you have anything else you'd like to add.
Hi, hi everyone. My name is Aubrey Sanchez. I am the Ohio CFR and FEMAR coordinator here at the state. We do collect that information through our case reporting system. We don't push everything out because we have so much data that's collected. We are working on a sleep-related death data brief for this year for 2024. So that will be for the past 5 years data. We are thinking of including more data like this. So like incident sleep location and whether that was the usual sleep surface. Those are some questions that are asked. A copy of the case reporting form is also available publicly. And so you can see all of the questions that we have, all of the data we have. So I can drop a link in the chat to the National Center for Fatality Review and Prevention. And that data sheet, which is what every review kind of goes through, is publicly available. So if you have any interest in looking at all of the wealth of the data that we collect, I will share that. It is a long document. There's a lot of information. But I will also pop my email address in the chat as well. And if there are any other follow-up questions, Haley and I also talk all the time, so she can relay any further questions to me. But thank you for your thorough, detailed presentation, Dr. Macklin. This is great.
Thank you. Thank you very much. All right, let's move on. So I was glancing through the chat while Aubrey was talking. It sounds like there is a lot of answers. Number one, thank you. Number two, a lot of co-sleeping. And related to co-sleeping, I also saw a lot of things in the crib, stuff in the crib. So we will actually discuss all of that and how you can help and how you can counsel. So going through again, what to do. So well over a decade or so now, the AAP task force on SIDS expanded its focus toward creating a safe a safe sleep environment for all infants. So instead of focusing just on SIDS, which by definition are kind of our unexplained sleep-related deaths, they really wanted to focus on all sleep-related deaths, those that we can explain, those that are preventable, that we know how to prevent. The asphyxia, the suffocation, the strangulation, all the ones that are out there. And so they made a lot of recommendations. These have been followed up twice with revisions to the recommendations, most recently in 2022. There were 19 recommendations directed at a number of different parties, parents and healthcare providers being a couple of those. We'll go through kind of a few of those on our way to the resources and some educational pieces. So next slide. And again, I said this first, but I'm going to say it again. Take care of your mental health. This is a heavy topic. The next few slides I have are going to be showing some death scene reenactments. Whenever a child dies, part of the CFR process is to, again, get a lot of information. And so there's always a thorough scene investigation, like where was the child found, what position, what was around him or her, what did this look like? There's an autopsy. There is, again, going through the medical records, other records as well. And so this is part of death scene reenactments and scene investigations from Cuyahoga County. These are about 12 or 13 or so years old pictures now. But I can assure you that we are still, unfortunately, finding infants in these positions and death scenes even this year, even today. So again, but please take care of yourself. Get off if you need to for a few minutes. We understand. Next slide. All right. Again, we all know this, back to sleep every time. This has been a thing since the 1990s. There were all kinds of cool, catchy, slogans and ad programs for this. It still applies. Supine sleeping until 1 year of age. We used to say side sleeping was okay, and that maybe was even better than stomach. We now don't even do that anymore. Side sleeping is not safe. It shouldn't be advised. Even if babies have reflux or they're spitty or what have you, supine every time. Next slide. The correct sleep environment. And again, we hit on this a little bit. This should be a firm, flat, non-inclined sleep surface to reduce the risk of suffocation or wedging or entrapment. Ideally, cribs should be new. We kind of have a illustration or a photograph there of a used crib that did not work out as well, unfortunately, and a mattress designed for the crib. So sometimes families, in efforts to save money, will have a crib and will use a mattress that's maybe not fit for the crib, maybe a smaller mattress, and sometimes the infant can have a suffocation incident between that mattress and the crib rail, and obviously not a good situation. Car seats and sitting devices, swings are not recommended for infant sleeping. Slide. Everything out of the crib, everything out of the sleep environment. Again, a very big thing here and things that we are still seeing. Pillows, quilts, comforters, blankets, sheets, other soft surfaces. These increase the risk of SIDS, sleep-related deaths, fivefold. Even if the baby is placed in a supine position, this is still a tremendous risk. And maybe other than co-sleeping or surface sharing, maybe kind of the biggest thing I still see whenever I do, sleep audits, whenever I hear about sleep-related deaths, is just extra stuff in the sleep environment that shouldn't be there. So this is a big one. Next slide. Breastfeeding. Breastfeeding is good for so many reasons, not just for the baby, but for the mom as well. And I could give you a whole hour-long lecture on the benefits of breastfeeding for babies and for infants, but that's another conversation. So there was a really interesting study done a number of years ago. It was a meta-analysis, thousands of sleep-related death cases and thousands of controls. They looked at a number of co-founders. We used to say that any bit of breastfeeding was good. Any bit of breastfeeding is still really good. Again, we talk about pediatric and maternal health, but specifically looking at sleep-related death, no protection was conferred if infant breastfed less than 2 months, even if breastfeeding was exclusive. So womp womp there. But again, breastfeeding is good for so many other things. It did show a protective benefit if the infant was breastfed longer than 2 months. So physicians should absolutely counsel parents to breastfeed per AAP recommendations, and the longer, the more exclusive, the better. Next slide. Talking a little bit about infant sleep location and breastfeeding. And I will say before we get too far, I have a number of slides that we are going to be hitting on in about 5 or 6 slides or now that we're going to be talking about how to make this work, because I know this is a hot topic. There was an interesting study done, though, a few years ago, back in 2016 in Academic Peds. It was a study of postpartum moms about 2 months after delivery. They got enrolled in this study during their time in the delivery hospitals after they'd given birth. And then they got a survey about 2 months after delivery. They found that moms who bed shared or surface shared were 2.5 times more likely to be exclusively breastfeeding. But they also found that 60% of exclusively breastfeeding moms were room sharing overall, meaning that you could still have a successful breastfeeding relationship if you room shared rather than bed shared. They also found that, they did follow-up surveys here. If moms received advice on room sharing and breastfeeding rather than bed sharing and breastfeeding, this increased both behaviors dose dependently. So what you say matters. And I know sometimes as a pediatrician, it feels like you are talking to the walls and no one is paying attention. But this slide kind of says otherwise, like our parents are listening to us, and it might not be the right time for them to make action, but they are hearing what you say, and what you say matters. So we are going to come back to this idea here in just a few minutes. So next slide. Yes to room sharing, no to surface sharing. And I will say to start with, I use surface sharing and bed sharing kind of interchangeably here. Some of the kind of the newer data research I've seen goes to talks about surface sharing. So I'm kind of using both interchangeably there. So surface sharing could also be couch sharing, chair sharing, another surface besides a bed. Regardless, sleeping in the same room but not on the same surface decreases the risk of SIDS sleep-related deaths by 50%. You're less likely to suffocate if you are close by and can hear kind of your baby's breathing patterns, but aren't actually in the same environment because, again, less risk of suffocation, less risk of overheating, rebreathing, airway obstruction. Again, a number of different things. So room sharing is good, bed sharing or surface sharing is not as good. What about twins? We do still recommend separate sleep surfaces for those. Studies have shown that any potential benefits of surface sharing for twins in higher order multiples are outweighed by the risk of surface sharing. So, people think it's cute to have twins in a crib. They're their own kind of sleep related risk. Again, there's things in the crib. We don't want things in the crib. So everyone should have their own space. So let's talk about co-sleeping. So I suspect many of you have heard of James McKenna. If not, he is a longstanding anthropologist at Notre Dame. He is recognized as the world's leading authority on mother-infant co-sleeping in relationship to breastfeeding and SIDS. He has co-authored a ton of articles. You can Google him and you will find a number of things. He states that mother and infants have evolved to co-sleep. However, modern bedding and beds have not really. And so I'm going to post this picture here on the next slide. So next slide here. This is kind of a normal American bed. Lots of pillows, a big floofy comforter. Honestly, it looks very comfortable and something I wouldn't mind crawling into after this webinar is done. But super risky if you are a baby with not developed head or neck control, potentially breathing in someone else's expired gases, carbon dioxide. And again, it's a super risky thing. And so yes, we maybe perhaps have evolved to co-sleeping, but maybe not in the sleep environments that we have created for ourselves in our society and our culture. And again, here's an example of this. Talking, and go ahead to the next slide. So per the latest AAP guidelines, the safest place for an infant to sleep is on a separate sleep surface designed for infants close to beds. However, they finally acknowledged, this latest revisions that bed sharing can occur unintentionally if infants fall asleep while feeding their infants, or at times when parents are particularly tired or infants are maybe fuzzy, but fussy. So bed sharing can happen. So they acknowledged it. It does happen. If you are with a very newborn colicky baby who doesn't sleep, it absolutely can happen. And so I do give kudos to the AAP for finally discussing this and bringing it up in their recommendations, and kind of going through a little bit. And let's discuss how to deal with this. Next slide. Go back. So per the data, when is the infant most at risk? And again, we can see some of these trends based on the CFR data we just reported a few slides ago. But babies are dying most when they're under 4 months of age. Babies are more at risk of death whenever they're preterm rather than full term and healthy. Babies are most at risk whenever there is a current smoker in bed, and so they're breathing in that secondhand, third-hand smoke. Babies are most at risk whenever they're bed sharing or surface sharing with someone who's under the influence of something: alcohol, illicit drugs, pain medications, controlled substances. Babies are most at risk when they're bed sharing with another child or multiple other people in bed other than mom. And babies are most at risk when they're placed on a very soft surface or surrounded by soft bedding. Again, kind of like that bed we just saw in the last slide. This does not mean that babies are not at risk at other times, but again, looking through all this child fatality review, death, not just in our state, but around the world, or around the country, these are some of the biggest risk factors. Next slide. And I will point you as well to the Academy of Breastfeeding Medicine puts out a number of protocols, and this is their bed sharing and breastfeeding one. And they echo a lot of the similar themes that we just discussed in the previous slide. Things that are the riskiest: sharing a chair, sleeping on soft bedding, babies being born premature, sleeping in another position other than what is, supine. So a lot of the same things. Next slide. So the million-dollar question is, what do we do when parents decide to surface share or bed share? Well, we meet them where they are, because sometimes that is all you can do as a pediatrician. We absolutely should be educating on the ABCs, alone, back, crib. We should be counseling appropriately, but again, meeting them where they are, not promoting unsafe sleep behaviors, but not judging our parents for it either. Really going for risk mitigation and minimization over than full-on elimination. If you have a family that you have been involved with, counseling, caring for years, and they're not going to or not currently practicing safe sleep recommendations, let's talk a little bit about how to make things a little safer. Next slide. So if parents decide to bed, surface share, co-sleep, whatever you want to call it, counsel on the risk, especially related to preterm and younger infants. Counsel on the dangers specifically of tobacco, alcohol, illicit drug, prescription drug use. Counsel on the importance of breastfeeding, as a protective benefit, especially over 2 months of age. Despite our data, in Ohio, nationally, and per the AAP recommendations, it is safer to share space in a bed rather than a couch or a chair. So if a mom or, whatever is going to share a space with her baby, it should be in a bed. Now let's make that bed safe. If parents are really into surface sharing, counseling them to get rid of all those fluffy blankets in the bed. Mom should sleep in sweats, sweatpants, sweatshirt, or a hoodie. No pillows. And if there is a pillow, maybe a small throw pillow or a neck pillow, but not the big fluffy pillows we saw in the slide a few minutes ago. Some parents I know use toddler rails or the bed, or not having the mattress high up, but rather having it on the floor against a wall. So there's less worry about a baby falling out of the bed and coming trapped between a nightstand in the bed or the wall on the bed or a dresser in the bed or whatever is close to the bed. So having a way, a little bit more dependable way to where they can't fall out of that space. And then ideally mom only. And again, I realize this might be unpopular, but if we are really going for making a safer, not safe, but safer space, mom only, no other kids, no other pets. Maybe dad goes to a spare bedroom or a couch or some other space, but ideally mom and baby only in that safe sleep space. Again, these are not necessarily AAP approved recommendations, but these are meeting parents where they are, and trying to make things safer, risk mitigation and minimization rather than total elimination. Because the last thing certainly you want to do is create an environment where you want parents to work with you. And sometimes that involves, again, meeting them where they are, even if that's not exactly where you are, and finding ways to make things as safe as possible. So these are some recommendations, and I'll direct you to the next slide. Again, going through that Academy of Breastfeeding Medicine protocol, a lot of the same things here. Keeping babies away from parents impaired by alcohol or drugs, secondhand smoke. The infant should not be alone in the bed. A lot of the same things. And I will bring this up. There was a question about the Safe Sleep 7. I think in the questions that we got before this webinar, a lot of the Safe Sleep 7, if you've not heard, these are some recommendations for safe or at least safer co-sleeping that are put out by the La Leche League. And a lot of these are based on, again, kind of these slides, the protocol here that we mentioned and the recommendations. So again, risk minimization. Perfect. Thank you. All right, next slide. So interestingly enough, there was a study done by NPR, or at least reported out in NPR a few years ago, looking at New Zealand and the United Kingdom physicians. So they customized the risk of bed sharing there based on, again, whether an infant is term or preterm, going through all the different sleep environment factors that we've talked about, parental behaviors, tobacco use, etc. And they've apparently been doing this for years, and they have seen a drop in their infant mortality rates. Again, kind of counseling on how to make things safe based on the risk factors they have. This is not anything that the United States have jumped on yet. I don't know if it will ever come, but it's kind of interesting to hear how other countries are addressing this as well, because it certainly is a topic worldwide. Next slide. All right. So some final thoughts on surface sharing, bed sharing, etc. There's no strong studies exist on sleep-related deaths or infant mortality rates of planned bed sharing versus unplanned bed sharing. So again, it's best to counsel families to avoid bed sharing, surface sharing, or to do so as safely as possible. And if you know your families well, customizing those risks, again, for risk mitigation is probably the way to go. Make sure they know what the recommendations are, but again, meet them where they are. Most important. Next slide. So going through the last few minutes, some resources. And I will say, this is not an exhaustive list. Again, we could spend a whole other hour going through resources for safe sleep and breastfeeding in the state and the country. But you all don't have that kind of time. So we'll hit on a few highlights. Again, I'm happy to put some more in kind of the follow-up that we'll be sending you all after this webinar is complete. So next slide. I would be remiss if I didn't mention the Ohio Department of Health, already discussed earlier. They have a number of educational materials on their website, videos in multiple languages, brochures, flyers, posters. If you're looking for things to hand to your families or to put in your office, this is a good place to start. Next slide. Cribs for Kids. All right, let's talk a little bit about this one. So I suspect most of you have heard of Cribs for Kids. Cribs for Kids provides funding to organizations that promote safe sleep practices, and they distribute cribs to eligible families. There's some criteria there. Families must have less than or make less than 200% of the poverty level. It doesn't necessarily have to be the parents. It can be caregivers. If parents or caregivers have more than one baby, a twin or a multiple birth, they can be eligible for sleep services or cribs for both of those or more of those babies. And then the dispensing organizations, so the organizations that are getting the funds from the Cribs for Kids, have their own criteria on whether, more than one crib can be provided to parents residing in the different homes. So I will go to the next slide because this kind of gives us information about which counties have Cribs for Kids providers in our state. The green areas have Cribs for Kids providers. The white, unfortunately, do not. I realize that means that not every county has a Cribs for Kids provider, but a majority do. You will see numbers next to or underneath the county's names. That does not represent how many providers there have. I live in Franklin County. I don't think we actually have 10 Cribs for Kids providers, but accompanying this slide came from a PDF. It is a number of lines long, which is why I did not necessarily put the whole URL here. I can send it in the follow-up that we do here. But it lists, number 26 is, I'm making this up, Lorain County, and these are the areas that have this. So it's kind of a list more than like a number of sites per county, but I will make sure to include that so you have access to that. And you can see where your local resources are to provide kids or cribs for your families. So next slide. Breastfeeding support. I think Haley might have already dropped the first link in the chat, or someone did. So thank you, whoever did that. But Ohio Breastfeeding Alliance, we mentioned the Leche League. I love the 24-hour breastfeeding hotline. This is maintained by the Appalachian Breastfeeding Network for ODH. It is not necessarily for just the Appalachian counties. I know we had that map that kind of discussed those. It's for any county in Ohio, Appalachian or not, and it is free of charge. So I think this is a great resource to give to breastfeeding moms. Great if they can have in-support lactation services close to you, but if not, here is a resource to help wherever you are. And then, of course, WIC programs in every Ohio county as well. Next slide. And again, I would be remiss if I did not end with some of the more local resources. If you live particularly in a metropolitan area, and I will say this is really more for the metropolitan areas, unfortunately, but these are also where the babies are dying based on our CFR data. There's lots of resources to help with the goal of babies reaching their first birthday. And so that's not necessarily limited to sleep-related deaths, but certainly some resources to help with those. And then some of the other factors that we have related to issues that might prevent babies from reaching their first birthday. So Cradle Cincinnati, obviously in the southwest corner of the state. Celebrate One is Columbus's. First Year Cleveland obviously is Cleveland. Everyone Reach One is Dayton and Montgomery counties, and I, for the life of me, can't remember full term first birthday. I think that might be Toledo, but someone correct me if that's not right. So last slide. All right, so final conclusions as we end here. Akron, thank you very much. Apologies. Our infant mortality rates are not great. They are improving a little bit, but we, as you can see from, I think, the very first slide that I presented, we still lag behind many other developed countries and states. The lack of infant safe sleep practices contribute to our infant mortality rates. We have a lot of evidence why safe sleep is important. So obviously counseling families, educating them, meeting them where they are, providing resources on how to implement how to admit all this education. It's the right thing to do. We keep working at it. Next slide. And I will end here. Again, not trying to be super funny, but take a deep breath. I think we are probably all done with winter and we're ready for spring and warmer and nicer weather. But thank you for participating. Thank you for being involved. We'll try to get to a few more questions here at the very end. I realize we only have 5 minutes left, but I will personally make sure that every question you have had either before this session or afterwards gets typed up and sent out in the next day or so. So again, thank you for your time. Thank you for your interest. Thank you for making a difference in our babies in the state. Appreciate you.
Thank you, Dr. Macklin. I have been capturing questions from the chat and resources, so thanks everyone for your activity there. Do feel free to continue adding those, even if we don't have a chance to get to them all today. As Dr. Macklin said, we'll do our best to pretty quickly turn that around to get things out, and I will add the links that you have provided to our follow-up website and email as well. I'm looking to see if maybe we could pick one question that seems to have come up semi-repeatedly and just see if there's any information on that, which seems to be related to if there is a connection between substance exposure, either prenatally or postnatally, and potentially marijuana specifically.
So that's a great question. And actually, marijuana is it is an area that is being researched. So not a lot of great data. So I will say nothing at least that is covered in the CFR report. Aubrey, if she's on and wants to discuss maybe some of the trends she sees around the state, that would be great. At this point, what we are advised to do, and again, I think the Academy of Breastfeeding Medicine has a protocol on whether to advise, families to breastfeed or not with marijuana use. So that's a kind of a corollary. But as far as the safe sleep piece, again, if parents are under the, any parents are in the influence of any kind of illicit drug, and I would put marijuana in there as well. And I realize, there's certainly, it's legal here now. But I would counsel them the same if it was any other illicit drug. And I would, say, I would much rather you, breastfeed, stop marijuana. I would advise not to co-sleep if folks are under the influence of marijuana. But again, doing your best to meet families where they are. But again, a lot of research being done on this, but that's kind of where we are at this point.
Thank you, Dr. Macklin. As mentioned, everyone else feel free, if you had a question and we haven't had a chance to answer, I've thrown some information into the chat, but I have captured those and we will send out follow-up documentation. In order to make sure we wrap up on time, I'm just going to advance us to a few final closing reminders, and then we will end about 1 p.m. So for some final announcements, I did want to highlight a few additional Ohio AAP resources that may be of interest to this group. First, we have a couple of education sessions coming up that are CME or MOC Part 2 if you are ABP boarded. These are coming up March 6th and March 19th. They both are connected to our Lead-Free Ohio program and education on lead poisoning prevention. So there's a QR code here, and in the follow-up email, I'll include the link you can click to register. We also have our lead poisoning prevention board book available now in 4 languages. They are free to request, even if you're not a pediatrician or an Ohio AAP member. So the link is there, and that will be in the follow-up email. But we've had some great feedback, and we are excited that we do still have more books that are available to distribute over the next few months. And finally, the Ohio AAP's spring meeting is an advocacy day this year, happening April 10th at the Ohio State House. If you are interested in learning more about advocacy and then even participating in legislative visits that afternoon, this is a great opportunity, and we would love for you to consider joining us. It is a free meeting. There are QR codes here, but again, these links will be in follow-up email. And finally, we'll end the way we started with a reminder that you will get a follow-up to receive the presentation materials, recording, all of these links, and the survey to obtain your CME credit. So it's a brief online survey, and then your certificate will be emailed directly to you as a PDF. And with that, I'm going to close us out for today. Thank you so much, everyone, for participating. This has been a great opportunity to share with you. And if you have questions, we'll look forward to following up with you offline in the future. Thanks, everyone. Have a great day.
Thank you all.